Yes. So we are live now. Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we are conducting a letter. The case is right below knee amputation and the name of the patient is Jacob McCarthy. Yes, you can go through these case notes. This is taken from Kaplan for study purposes. This is taken from Kaplan, the official guide. You can go through these notes.
He is also afraid of talking.
One second, please. Yeah. This is the second page. Now we have two letters here, one for the doctors and one for the nurses. Those who are doctors, write your name and write doctor. And those who are nurses, write your name, first, second names, and write nurse, so that I'll take the attendance to find out who is the regular student and till what time they are joining. Write your first name and second name and your profession. Good. Thank you for giving your names. Very good. 7 members wrote the names. That's so nice of you. Yes. This is a medical letter. And now this is the writing task for the nursing. So we have two different letters, one for nursing and one for doctor. Yeah. Yeah, this is actually a demo session for the students who wish to join for this new batch. Right. Now let us see. We have seen the case notes. Now let us first start with the medicine letter. Yeah. Now let us join here. Now I want you to write the address. I want you to write the address. Okay. This medical letter. So first, before going to that one, what is the information that we are going to get from here? What is the information that we are going to get from here? That's what we are going to note down. Yeah. Yes. Now, here, let us learn one by one, step by step. So first line, what are you going, this medical letter, first you will write the address and then the date. Okay, now what in the address? So we are going to write the address. Number one, first component is the address. Okay, the first component is the address. So these are the 7 components that we are going to use. Okay, these are the 7 components that we are going to use now. So let me mention here. So I'll give you here the 7 components. These are the 7 components that we are going to use. The first one will be the address. The first one will be the address. Now we are going to write the address. Okay. Now let us take the address. Yeah. So now let us find out what will go into the address. Now look at this and check what type of letter it is. Is it a referral letter or a discharge letter or a transfer letter? Come on, write down your answer. Write down what you want to write down. So what type of letter is this? Okay. What type of letter is this? You can just make a mention of this. What type of letter? Okay. Right. It's a discharge letter. Okay, fine. That's understood. It's a discharge letter. So participate actively when I'm asking some questions so that, okay, your mind will think very fast. That is what I mean. The exam, you have to think very fast. Okay. Now coming to the point. What's the, here you will take address from this place. What is the first line that you are going to write? Come on. Write down your first line. Finished. First line. First line. What is the first line that you are going to write? Yeah. So Dr. Shannon McCann. Okay, you need not put full stop. Even if you don't put, it's okay. But you have to be very clear with your spelling. Okay, this is the first line. No need comma, no need anything. Okay. So copy text. Okay. So this is the first line. Mhm. Okay. So this is the first line we are going to write. This is the address. So the number one is the address. We are going to take the address from here. Okay. Address. Let me write here the address. Okay. So Dr. Shannon McCann. So the rule is you have to write capital letters. Okay. You have to write capital letters. Whenever you are writing address, everything should be in capital letters. First letter of every word should be in capital letters, unless and until it is a preposition or an article or a conjunction. Otherwise, it will be capital letters. Okay, next one. Next point is second. Now write the second line. You can write and keep it. When I ask you to submit, you can just submit. Second line, because you know what we are going to write next. Okay. Second line. Yeah. So that is the second line. That is medical director. See, I also do mistakes, but I correct. Medical director. Okay. After medical director. Yeah, come on, write down, participate, everyone. We have to go very fast. I'm waiting for you. Don't make me slow. Don't make me slow. We have a lot of things to cover. Yes, sir. You can't write 2 words, 3 words. I'm going to spend a lot of time for you. This is for you only. You're doing a favor to yourself, not to me. Okay. If you cannot be directly, actively participating now in the exam, how can you actively think? Okay. I'm making you think in the directions. Okay. Yes. So medical director. Next, third line. Third line. Come on. Third line. What you will write? Whatever you write, that I will put. Okay. Whatever you write, that only I'll put there. So participate, please. Yeah. Third one. Third point is here. Knox Skilled Nursing Facility. Yeah. Knox Skilled Nursing Facility. K capital letter NOX SKILLED Nursing Facility. Yes. That is what you have to write. Next one. Fourth line. Yes, fourth line. Fourth line. Yeah. Sometimes they will write AVE or RD. Okay. So they'll write like that. You have to be very careful. You have to write the full word, not half. Yeah. So next one is, yeah, here it is. Right. 25 Harrow Field Avenue, and last line is yes. So the fifth line, yes. So this is how we are going to write the address. That is the address. Yeah. So no put commas, full stops, nothing, no need. That's accepted readily. So no need to panic about that. So this is the medical letter address. Fine. Medical letter. We are writing a discharge letter to Shannon McCam, Medical Director, Knox Skilled Nursing Facility, 25 Harrowfield Avenue, Knox. Yeah, that's fine. Okay. So this is the address for doctors. And now let us see the address for nurses. Okay. The address for nurses. Then now, how are you going to write this address? Yeah, first line. First line. Write down the first line. Yeah. Very good. Thank you very much. Shannon McCam. Yeah, that's the first line. Very good. Yeah, those who have finished first line can write the second line. Those who have finished the second line can write the third line. Shannon McCam, receiving nurse. So when you don't know anything, you should write some title, right? Miss or Mrs. or MISS Miss. When you don't know anything, then you have to write MS. Okay? Then you have to write MS. Here it is doctor you have written because it's a doctor. Okay? But here Shannon McCann is not a doctor here. She is the receiving nurse. So you have to write something. No, you made a mistake here. You made a mistake. You did not even think about this one. Title. How can it be without a title? Miss Shannon McCann. That's it. So Miss Shannon McCann. This is how you have to write. Next one is receiving nurse. Receiving nurse. You did not write that one. Why? Receiving nurse. Why you did not write? Write a transfer letter to the receiving nurse. Okay. So why did you not write that receiving nurse? Okay. So this is how you make mistakes. You lose some marks here. You don't know that. So now let us see here. Shannon McCann, receiving nurse. That is her title, like doctor. Okay. Here is a medical director. Like that here, receiving nurse is a title. Nah? Why you did not write? Why you did not bother about that? Huh? Next. Next one is Knox Skilled Nursing Facility. Knox Skilled Nursing Facility. These some simple things if we don't follow, no? So then in the exam also, make it a habit from now itself. Why students are able to get 450? Harrowfield Avenue. Okay. And Knox. Right. This is the address. This is the address. So you started from Shannon McCam and you went forward. Who will check about this one? Okay. Why are you not bothered about what profession she is? Okay, now let us check. What type of letter is this? The type of letter. What type of letter is this? Is it a referral letter or a discharge letter or a transfer letter? What type of letter is this? Yeah, come on. Yeah, this is a transfer letter. This is a transfer letter. Remember that. Fine. So, but the doctor's letter is a discharge letter. So this shows that the same information can be used as a discharge letter or a transfer letter or a referral letter. Information might be the same, but the way how you are writing differs. Okay. If you are sending a letter for a new person first time, that will be a referral letter. And if the patient is okay going to some other facility, okay, some other facility, it is a transfer letter. For example, hospital to care home to hospital. Okay. So if he's going to a new place, first time going there, and you are referring the patient, that will be a referral letter. So referral letter will be upbound. Transfer letter will be downbound. And discharge letter will be homebound or care home bound. So the upward journey, mostly transfer letter will be upward journey. Mostly referral letter, sorry. Referral letter will be upward journey. A doctor will send to a psychiatrist or a cardiologist, a higher level or parallel level. For example, as a doctor will send it to an orthopedic surgeon, or a doctor may send it to an ophthalmologist, parallel or upward. So first time you are sending, that will be a referral letter. You don't know, but I know this patient. I know this patient and I know that doctor, but this doctor and patient don't not know one another. Okay. Many people think they know all these things, but there are some secrets which you have to follow. For example, referral letter means what? Some people write, I am referring back. There is nothing called referring back. When the person already knows the patient, how can you refer back? Refer means to introduce someone to someone for the first time when they do not know one another or each other. They do not know each other. Two people. The patient doesn't know the doctor doesn't know the patient, but you know both. So you are referring this patient to that doctor because this patient can be treated by that doctor. That's it. So you are making both the ends meet. You have a patient and you cannot manage them. It's beyond your capacity. Then you are seeking the help of a specialist. You're seeking the help of a specialist. For example, the person has a heart problem and you are a normal doctor, or you can say physician or general practitioner. You're not a specialist to deal with the heart problems. So what you do is, I am helpless. I cannot do anything. The patient is in my hands now, but I am not the authority to deal this patient's problem. So what I'll do, I'll make this patient meet this doctor who is specialist in this particular area called heart operations, who deals with cardiac patients, who is a specialist. We call it cardiologist. So you know this patient and you know this cardiologist. Now what you are doing is, this cardiologist and this patient, they do not know one another. They know 0% about them, the other person. Now it is your responsibility to make this patient to meet this particular doctor. So try to understand the secret between what is a referral letter. Just writing a referral letter means, I'm writing a referral. But what is the purpose of writing a letter, a referral letter? There's a purpose, no? You're referring somebody to somebody because they both do not know one another. And the purpose of the letter is, this person requires cardiac treatment or a surgery. He has cardiac problems and only that person can handle it properly. I know a doctor who can treat this patient. That is what you can tell the patient. I know a doctor who can treat you. You do not know him. Now, you will tell the doctor, I know a patient who has heart problems, and you do not know this patient. So you are the mediator between the person who requires the treatment and the person who gives the treatment. You are the mediator. Your role is to mediate, communicate, and make these both ends meet. So that means you are the middleman. You are the middleman. That means you are taking these goods and you are selling to that person, the producer and the buyer and the middleman. So like that, your hand. They are doing good for both the people. Otherwise, they will not meet one another. So that is the purpose of a referral letter. You are making those two people meet one another. Then only the purpose is solved. That cardiac treatment will be done because he needs treatment and he gives treatment. So both match together. But you are the middleman. That's all. That is the only role you are going to. You will give all the information of the patient to the doctor, that particular doctor, because you know everything because of the case. You handled it and you did many things. And now I am helpless. I cannot do anything else because this is out of my specialty. I am limited. You are unlimited in this particular area. So you decide that he has a heart problem and you send him to the heart specialist. You will not send him to the pulmonologist. You will not send him to the craniologist. You will not send him to a surgeon. You will find out what exactly is the problem and you will make the person who can treat that problem, you will identify and match these two poles. That is the purpose of a referral. So be a middleman and pass on everything properly, like a salesman, how he sells his goods, everything. This quality, this. He explains everything and he will be a successful salesman only when he can sell the goods. So if you are not able to pass in the exam, that means you are not a successful salesman here. You're not able to communicate properly to the other doctor. That's why you fail in the exam. Many people fail in the exam because they are not able to do their business, that is selling their goods to the other person. So that's why we are failing. So be selective, choosy, give relevant information, organize the subject properly, and then send it to the other person. What he requires. For example, you're sending a letter to a cardiologist. What is the need for you to provide information regarding diet? You're sending a letter to a dietitian. What is the need for you to send something related to exercise? Okay. So try to understand that is related to that person only you have to give. Don't give anything else. Eye problems. You won't explain to the cardiologist. Okay. So what is related? That only you have to select and you have to give. That's very, very important. That's a referral letter. Now, what is a transfer letter? So, referral letter almost always goes up or parallel. Up or parallel. Up means from junior to senior, from normal physician to a specialist professional. So, for example, a doctor, a physician, a general practitioner is general practitioner. He is not specialist to do surgeries related to brain, heart, or kidney. So you are sending to that professional who can specifically handle that problem because he is the authority over that subject called brain or heart or liver or kidney, whatever. So lungs, pulmonologist. If you have a problem with lungs, you cannot handle, it's going beyond, so you'll send him to a pulmonologist. Head related, craniologist. Heart related, cardiologist. Like that. So you know what is normal treatment you will do, which requires specialized attention. You will say that is the referral letter. Because the person to whom you are sending, that particular person does not know this patient, and the person whom you are sending, this particular patient, does not know that doctor. So you are the communication, the middleman, the bridge between the both ends. Otherwise, if you are not there, these two sides do not meet. That's it. So you are very specific, playing a specific role here. So when passing on this patient, you have to give all the information pertinent, Pertinent, pertinent means very, very important. Or you can say relevant, or you can say necessary or needed, much needed information of priority based information you have to pass on. That is a referral letter. Now coming to the transfer letter. Transfer letter is a downbound. Downbound. What do you mean by downbound? From a surgery to a ward. From emergency department to an ordinary ward. From a hospital ward. Or from head branch, head office, head hospital, main hospital to subordinate hospitals. Subordinate hospitals. Downbound. Or from hospital to care home. That means the treatment is continued. The treatment is not ended. It's not a full stop. The treatment is continuing. And the care is transferred from a busy hospital to an easy one, simpler one. Okay? where the people who can provide care, for example, rehabilitation center, care home, hospital wards, or subordinate clinics. Okay. So transferred from the hospital to a practice, medical practice, or a clinic. So now you are transferring this patient to provide only that particular care because this hospital needs beds for the newcomers. You cannot keep them just for being watched, monitored, and cared. Now, emergency condition is gone, so you can rely on the ordinary facilities rather than the multi-speciality hospitals. So, which need to attend emergency patients or serious patients. Right. This is transfer letter. It's normally parallel or downbound. Now, what is parallel and what is downbound? So, you're transferring a patient because this particular facility is not in this. For example, you treat somebody with something and he has some other problems and that can be treated in some other place. Then you can transfer there. Okay. You can transfer him to. So, you can transfer a patient from the normal ward to the emergency ward to the normal ward. So parallel. Okay. And then a higher facility to a lower facility, hospital to rehabilitation center, hospital to care home, because continuity of care is required. So this is the purpose of a transfer letter. So discharge letter normally is different. Discharge letter, you write when the person is going to the final destination. Final destination. The final destination may be his home or a refugee center or a care home. From where he started his journey to there only he goes. For example, Lionel Ramamurthy is in the care home for the last 4 years. And he's again going to the care home. He is living there and he's going there only. That is his final destination because he doesn't have anybody to take care of him. Next, he came from his home. He is living independently and you're sending him back home. That is discharge letter. Back home, back to the facility, back to the same place from where he came. So it is back to the pavilion. That is called a discharge letter. Okay. So remember these points very carefully. Now I have shown you what's the difference. And there are some other letters also, but they are not very frequent in the exam. So that we will see when and where we face it, we encounter it, we'll deal with that. Now, was the explanation. The explanation, okay, is clear enough, okay, then you can give a comment whether you understood or not, how beneficial was it, and what did you learn from it. Was the 5 minutes which we spent on the difference between a referral letter, transfer letter, and discharge letter? If it is very clear, minute, and specific, give a sentence. Or if you don't want to give anything, just put a thumbs up or whatever you want. One word. I just want to know what you learned from this one. Yeah, we are going to deal with discharge letter. We are going to learn more. Just give one sentence or one comment. What did you learn? Was it clear enough? Yeah. Take 30 seconds to write a sentence or two. Be generous enough. Somebody is trying to give you valuable information and you don't have that goodwill to at least say that you have understood. Okay. It puts the performer down. Okay. I'm asking you whether you understood or not. That is not going to benefit. Your comment is not going to benefit me much. But I'll be happy that you understood. That's it. So be generous and try to write one comment at least. Because we are going to learn number of things. And even a comedian or an artist or an actor on the road also, he deserves a clap. You are ready to clap for them. But a person who is going on speaking for hours together from the depth of his heart, okay, just a sentence that you have understood, he will be happy. Yeah, referral to superior level, got crystal clear information. It really makes sense to understand. That's good. Yes, okay. Fine. Right, that's done. Now we are going to write the date. Next one is the date. You can see here. The address is done. Okay. The address. Okay, leave that. Right. So next we are going to find the address. Sorry, date. Now where is the date? Let us say this is discharge. Date. Let us check the date here. Discharge date is here. This is the discharge date. Okay. This is the discharged date. Okay. Now you have to write the same like this, discharge date. And when is he going to be discharged or she is going to be discharged? So that is the same date. And you are going to write the same date as, okay, fine. So 26th April 2018, you have to write as it is. There is no other option for you. So the date. Number 2, the date. The date is 26 April. That means day after tomorrow. Okay, 2024. Sorry, 2018. Okay, 2018. Okay. So today's date, according to the letter, is 26th April 2008. People don't even look here. Yeah. Yes. So the date. This is the date. 26 April 2018. Yeah. So next, salutation, number 3. Yeah, it's always better to write like this, okay? It's always better to write, because if you write 4, no? So officially there is a specific name for 04 month. So when you see, for example, you are a doctor and your name is Omote, okay? Then so you'll be like to call as your name, not as doctor, okay? That's professional different. But when you have a specific name, okay? See, for example, a cardiologist. Yeah, cardiologist is also a doctor, and an MBBS medical practitioner is also a doctor. So when you call the cardiologist as a doctor, he'll remind you, I'm a cardiologist. Okay. So when you are introducing a cardiologist, if you introduce him, this is a doctor, see, he'll feel in his heart, what? I'm not an ordinary doctor, I'm a cardiologist. Yes. So like that, when you have a special name, you have to give the special name. You see, any letter, it is written with the name of the month, not a 04 or 05. All of you. Okay. You want to check? I'll give you the proof. Okay. Check it out here. So every writing, this is medical sample. I'll give you a sample letter. See, 18 June, right? It is written June. So write the month, not 6. Okay, like that. Any letter you take like that. For example, let us take nursing letter. See, February. So try to understand that it is very, very important. 4th February. It is very, very important to write the name of the month in words, not in number. Remember that. Not one example, not 2 examples. I'll say hundreds of examples in official letters. Okay. So write like that. That is always better. Yeah. So once that is done, we are going to the salutation. Number 3. Salutation. Number 3 is the salutation. Now, how are you going to write the salutation? Come on, write the salutation. Here, age is there and name is there. Date of birth is there. You can write date of birth. Date of birth is there? No, date of birth is not given. Just age is given. So how are you going to write this? Come on. If you follow these rules and regulations, there is no doubt. First attempt only you will get cleared. Remember that. Yeah. So, salutation. Where you will write this, from where will you take salutation? Salutation you will take from the last. Yes, here. From the writing task. Yes, you have writing task, the salutation here. So you will take this one from here. That is Dr. Shannon McCann. So that you will codify here. Dear Dr. McCann, comma, dear Dr. McCann. Right, don't write the first name. Write the second name only. Write the second name only. And comma, omote, you are in your hurry, you are doing spelling mistakes. Okay? You are doing spelling mistake. Check your spelling and if possible rewrite. Now if it is here, the salutation will be like this. Dear Miss McCann, comma. That's it. Dear Miss McCann. Don't write dear nurse. And the name of a person is there, write name only directly. Okay. Yes. Next. Fine. Next we will go for subject line or regarding line. Yeah. We'll take it here, regarding line. Or we can say the subject. The subject. And the subject is Mr. Jacob McCarthy. Okay. So regarding R capital letter, E small letter, colon, and then say Mr. Jacob Mc, C capital letter, Mc, M capital letter, C small letter, then C capital letter. Remember that. Be very careful. McCarthy. Don't separate Mc and Carthy. It's McCarthy. McCarthy. Okay. Like McDonald's. Okay. We all know McDonald's. We see so many times, but still when writing, okay. Then an 82-year-old patient. Okay. So right. Aged 80. That's it. Regarding Mr. Jacob McCarthy, aged 82. So that is what you write. For both the places, it's the same, so no worries. Right. Very good. Thank you. Malika, after comma, you have to put a space, single letter space. Aged. Who is this? Keval Shah. Aged comma. No need comma, no need colon. You put colon there, no need colon. Just put aged space 82. Yeah. So when you write only, I can correct like this. You people think that we know it and you don't write. Huh? So aged 82, no semicolon. Date of birth, semicolon, but aged nothing. Okay. Aged nothing. Right. Now next we'll move to the fourth part. Fourth part is the letter body. Introduction, main body, conclusion, 5 paragraphs. That we'll see after we finish the other components. Okay. Right. So the sixth component then, fifth is over. Now the sixth component, salutation is over. Fourth, subject is over, salutation is over. Now we are going to the closing remarks. The closing remarks will again take you to the last part. Okay. Yeah, the writing task. Now here, closing remark will be here. 6. The closing remarks are the farewell. Whatever you want to say, you can say. It depends on dear McCam. If dear McCam is there, you will say yours sincerely. Yours sincerely. If instead of that one there is a doctor or nurse, name of a profession, then you will say yours faithfully. For this, you will write sincerely because it is dear Dr. McCann. Otherwise, if it is dear doctor, okay, then what you will write yours faithfully. If it is dear doctor or dear nurse or dear anything, okay, then you'll say yours faithfully. If you say dear Dr. McCann, name is there, then you'll say yours sincerely. Okay, sincerely. Right. Yes, next. Then next one is the sender's particulars. Sender's particulars. Seventh one, the sender's particulars. That you will go to the beginning. Okay, sender's particulars is here somewhere. All right. Sender's particulars. So we are going to write the address here. Okay. Here we will take it. Number 7, sender's particulars. What are the particulars of the sender? See here, Mr. Jacob McCarthy is an 82-year-old, is a patient in the medical surgical in which you are a physician or a nurse. So if you are a physician, you will write physician. Okay, you will leave 2 lines after yours. Leave 2 lines after your sincere. If I am telling something, I mean it. I'll show you. Many people say, why sir is telling 2 lines? Nobody is telling like this. Why sir is telling 2 lines? I'll show you once again. So medicine sample 1. See here. Everywhere 1 line only. Here it is 2 lines. You can see the difference there. Here 1 line, here 1 line, here 1 line. But here you can see 2 lines difference. 2 lines difference. Yeah. So always leave 2 lines there. That's very, very important. Now what you can do is, so not only here, you take any letter, it's the same thing. So here, Mr. Jacob McCarthy, an 82-year-old, is a patient in the medical surgical unit, okay, of which you are a physician. So you can write a physician. So you given a designation physician, okay. You can write a physician. Okay, fine. You can write physician because you are a physician, you are a doctor and you are writing. If you are a nurse, in your nurse letter, you have to write, you are a nurse, okay, you are a, in the medical surgical unit, okay, you are a nurse, registered nurse, or if necessary, he will say general practitioner. If he says general practitioner, write general practitioner, okay. If he says you are a doctor, write doctor. See what he has given you, write that because it's the designation what he has given you, okay. But here you are a physician, so write physician. Why panic? Whatever you want to write, don't write. Some people write their own names. Don't write. They did not tell that your name is so and so. Then why are you writing? Okay, if they tell you, then you can write. So physician or registered nurse. Where a medical surgical unit, for both it is the same thing. So common. I'm writing the next line. Okay, this is if you are a physician, what we can do is we can write that or this. Okay, why separately? So this is physician, P capital letter, registered nurse, R capital letter. Okay, which is suitable, you write that one. If you are a physician, write physician. One is enough. Now, why 2 things? If you are a physician, write physician. If you are a registered nurse, write registered nurse. Then next, medical surgical unit. Medical surgical unit. And then where, in which hospital? Jefferson County Hospital. It is there here. You can see here. Jefferson County Hospital. Okay. You can see here Jefferson County Hospital. You are in the medical surgical unit. So medical surgical is hyphenated. So I made a mistake here. I should also put a hyphen here. Even I made a mistake. So what is the problem? Anyone can make mistakes. So only the thing is you have to be clear and verify and check it out. Okay, medical surgical unit. So, right. The next one is Jefferson County Hospital. Many people don't write all this. Oh, I have finished a letter. Doctor, you are sincerely doctor finished. What are you doing then? If you don't notice these things, you got habituated to writing doctor and closing, folding the paper and sending. Not right. Give your details. No? How can he contact you if you don't write his complete address? Yeah? Make it a habit. Then 35 Franklin Street. 35 Franklin Street. And no. That's it. So let us take like that. So physician, registered nurse, anyone you can write. If you are a physician or a doctor, whatever you want to write, you write registered nurse, you want to write like this. And medical surgical unit, there is a hyphen in between. So whatever he gives, write like that only. Don't write whatever you want. And every letter in the address, wherever it is, whether the top address or the bottom address or anywhere, it should be capitalized. Remember that. Very clear. Okay, don't do a mistake. So this here, the information is already given, but we do not bother this information. So check for these bits of information and use them on a regular basis. Okay. Yeah. So that's done. So all the other parts are over. Okay. And if already nurses, doctors, both I have given. So now we are left with the body of the letter. So now let us see. The address finished, date done, the salutation over, the reference lines, yeah, given it, and the closing remarks, yeah, finished, and then the sender particulars, they are offered. Everything is very clear. Now we are left only with the fifth part, that is the body of the letter. Okay, so I think many people do not know that these things also carry marks. You will miss these things. See, for example, you already lost some 3 or 4 lines just writing doctor and closing it. Okay, so try to give all the information which is given. Simply he gave you all this address just as a showcase. No, he wants to use that address there and you don't use, so you will lose your mark. Instead of attempting for 500 question paper, you are attending only for 420 marks. What is the fun of it? So try to attempt for 500 marks. You may lose some marks, but here are easy marks. Okay. So what I'm telling you is, there are some marks which are called easy marks. Just copy paste. Why do you want to lose that particular thing, which is so easy? Maybe you'll get extra 20 or 30 marks. So what is the problem? Why do you want to lose that? Why do you not want to focus on that particular thing? Everything. Take it and use it appropriately. Okay. Receiving nurse. Receiving nurse. Many people did not use it. Many people will not use it. Sometimes it will be given. Write a letter to the chief medical officer Mr. Abraham Lincoln. So you will start with Mr. Abraham Lincoln and you'll forget Chief Medical Officer because address will go forward, you think. Sometimes he gives before also. So be careful. Right. So now we have finished with the starters and the desserts. We have finished A, the starters. So there are three parts, three components. The starters, okay. Then B, the main course. When you go for a dinner, we call these labels. The main course, what do you want for the main course, sir? They'll say, the waiter. Number C, the desserts. What is the dessert that you require after dinner? He'll say, ice cream. Yeah. So the starters, the main course, and the desserts. Now we have finished with the starters. Starters means before the main course, desserts after the main course. So starters will be appetizers that will make you ready to eat more. Okay, some soup or something like that. You feel like eating, So you are waking up the taste buds. The sleeping taste buds will be woken up. Right. So that's finished. A and C are finished. Are we clear? These two aspects. So we can go to the main course. Are we clear with this information? Give a yes, or if you have any confusion, you can say. So be generous to give a yes or a no so that I can understand. You have understood. Maybe thinking what I'm doing, I'm just sending the messages to the other students who might be interested. Yeah, just give one sentence. Ne? I'm giving you time to make some comments. So, right, there are a few. That's good. So we'll move to the main course. Okay. Now what I want you to do is, I want you to focus on the sentences. Yeah. Now let me convert this document by savings lecture notes. Yes. Let me take. Yeah. We'll convert this into Word document. File, save as, convert to Word document. Yeah. Yes. Now, we'll be focusing on these points. Yeah, fine. Now I have taken this so that we can take the words and we can write sentences on this. Okay. Now we'll take a one sentence and we'll write a sentence based on this one. So that will be helpful for us. So those who are depending on quality, definitely I am with you. Okay, because I'm going to do a lot of gimmicks. Yeah. So no. So that's it. This is our sentence. Okay. Now, how do we write? Yeah, I want to ask you one thing. How many of you are there who are serious to learn serious quality? Seriously. Okay. Because I'm going to show you some things which you can develop sentences. So, how serious are you? That means you have to practice with me, not just say yes, sir. Okay. I know, Dr. Keval, you will be ready. In the middle of the night, also, I call you, you will be ready. I know that. So, monitor surgical site for infection or drainage. Okay. So, reverse I'm giving. Okay. Okay. Right. So, very good. So many people are there ready to learn. Okay. Monitor surgical site for infection or drainage. Nursing management, you have already done that one, not a discharge plan. So you have done. This is a finished action. So you have to write in the past tense. You have to write in the past tense. Nursing management, you have been doing. Okay. You have been doing, right? You have been doing. So from the admission till discharge. Okay. From the surgery till now, the discharge you have been doing. So it is present perfect continuous tense. You have to use present perfect continuous tense. So you did and you are doing and you will continue to do until discharge. That's the point. Present. Now you are doing. Okay. You did, doing now, will do afterwards. That is called present perfect continuous tense. It happened till now, it was happening, it happened till now, and it will happen in the future also. That is what is present perfect continuous tense. Okay. So how are you going to write this particular sentence? How are you going to write this particular sentence? Yeah. You see how I am modifying. Okay. Yeah. Mature. Yeah, I merged both the cells. Now here we are going to write the sentence. Yeah, come on. What is the sentence you want to write for this one? I have given you there the point. So you'll get the point there. How will you write this one particular point? So nursing management from, so the starting time is from the time of surgery. From the time the surgery is completed. Okay, post surgery it began. The surgery finished, then continued from that day onwards. From the time the surgery was completed. Okay, from the completion of surgery. Okay, after surgery. So immediately after surgery. Okay, so surgical site in surgery done. Surgery done. From that time, okay, till the time of discharge. So so concentrate on the points there. Present perfect continuous tense from when till when. Okay, from the point of time till the point of time. That's it. From the point of time. Which point of time? Surgery finished. From the time the surgery finished. This is from time. Surgery performed. Okay. Till where? To the point of time. Till when? Time, discharge time. So discharge time. So from the time surgery finished, from that time till now, till discharge time. So now I am writing this letter. Discharge may be today evening or tomorrow morning or tomorrow afternoon or tomorrow evening, till that time. So what is happening? So you're monitoring the surgical site for infection or drainage. How are you going to write this? So it is a present perfect continuous tense. So what has, so how will you write this sentence? Come on, write down your sentence, please. Keval Shah, Mr. McCarthy's surgical site has been monitored for possible signs of infections and drainage. Very good. That's very good. Hmm. Anybody else? Come on, write different sentences. No? Write the sentences, whatever you want to. Yeah. So uh, Yeah. So monitor surgical site for infection. So what you're going to write here, yeah. Now you want to write in active voice, you can write in passive voice. You can write in active voice. Yeah, omote, you read was well managed. Was is past tense. Okay, was is past tense. That is also correct. But you are writing in past tense, was managed. But it is not going on nursing management. Now also you are monitoring, right? If you say was managed well, was managed well means past tense, finished. Now also going on. So has been. So you are going to use has. So continuation has. Okay. Have been. Okay, or has been. Have been monitoring. Okay. Come on, write down your sentences. You can write in passive voice, you can write in active voice. Okay. So, have been monitoring, like this it should. Monitoring the surgical incision site for any signs, for any possible signs and symptoms suggesting infection or drainage. So who I have been monitoring. I have been monitoring. I have been monitoring the surgical incision site. So during hospitalization, if you're at the beginning of the paragraph, you can write during hospitalization. Okay, or post surgery. Yeah, I also make mistake. Post surgery. Whenever you write these phrases during hospitalization, post surgery, okay, so you'll put a comma there. You'll put a comma there. Remember that. Now this is active voice, right? Yeah, you can write I have been or we have been, no problem. But this active voice is better than uh, passive voice is better than active voice. So what you can write here is start with the surgical incision site. Okay, just change the surgical. So I have been or we have been is not needed. The surgical incision site has been monitored. Now I'm going to show you something which is very important. Now this is active voice, nothing difference. This is active voice. Okay, everything else will be same. Okay, this is passive voice. Now what is the difference between active voice and passive voice? Now let us see very clearly here. Now this one is same. This is same. Okay, there is no difference in this. There is no difference in this. Now, what is changing? Try to understand this. What is changing? The surgical incision site, which is after the verb, So this one, which is after the verb, is coming forward. This is becoming the subject. That means it's very important. We are giving importance to what is to be given important. So what should be given important? What should be given important here? Why Mr. Karthi every time? Why so many times Mr. Karthi? Why? We know it is that one. Subject line only we said, Mr. McCarthy, Mr. McCarthy. It's okay. People are writing like that. That's different thing. We should know. Subject itself is everything there for him only. We need not write every time Mr. McCarthy. Just a direct topic. Just direct topic. Okay. The surgical. Now what is important here? Mr. McCarthy is important in this sentence. Now I want to ask you. Okay. Yeah. Now I want to ask you one thing here. We have three things here. One is the doctor who is treating the patient, or the nurse who is treating the patient who is being treated by the doctor, and the treatment which is being provided. In this particular sentence, who is important? The doctor is important, or the patient is important? The doctor is important, or the nurse? Doctor or nurse? Medical profession is important, or the patient is important, or the action you are taking in this particular sentence is important. What is important, you think? Can you tell me? Now, this particular sentence, I have been monitoring. I have been monitoring for any signs of infections. I have been monitoring Mr. McCarthy. I have been monitoring Mr. McCarthy for any signs of infection. Now here, I is there, McCarthy is there, and monitoring is there. Which is important? Which is coming fresh importance? Fresh importance. Is doctor important in this sentence or nurse important in this sentence? In this sentence. Okay. The doctor is like under the mat, water under the mat, spreading all over the mat. So why should give again importance to doctor who is there from the beginning of the letter to the ending of the letter? The person who is writing. Okay. The person who is writing the letter. Is he important? If he is important, then keep the patient with him only, na? Try to understand the logic here. The person who is writing the letter is from the beginning. I am writing to refer. I is already there from the beginning. Yours faithfully, sign, doctor or nurse. I am writing till doctor or nurse. From the beginning to the ending, the nurse is always there like a swing going from that side to this side. From the beginning to end, everything is there, hidden under the mat, like water under the mat. It's already getting wet. Doctor is already there. Nurse is already there. Then why are you bringing yourself every time? I have been monitoring. Why? If that is the case, that means in every sentence you have to write I. I have given this medication. I have asked him. I have every sentence write I, na? Why are you not writing in every sentence then? Okay. Next, second. Second one, the patient. Patient is important. We know that regarding line. From regarding line till the last Okay. In case you require any other information regarding Mr. McCarthy, please. So McCarthy is there. Regarding Mr. McCarthy, last also, if you require any additional information related to Mr. McCarthy, everything is there again under the mat. McCarthy is everywhere, it's a mat. You have three mats spreading from beginning till the end. Three mats. First mat is the doctor who is writing the letter or the nurse who is writing the letter. That means the person who is writing the letter. Letter is starting from whom? That person. The writer is already there. The writer is already there from the beginning to the ending. He is writing the letter. He is writing. He is only writing the letter. So why do you want to give the importance? I don't write. Number two, the patient. This letter is entirely attributed to that particular patient called Mr. McCarthy. Okay. Then why are you writing Mr. McCarthy in every line? Is it not madness? Mr. McCarthy has been monitored with a surgical site for possible infections and drainage during his hospitalization. So in this sentence, you are writing Mr. McCarthy. Okay. In a particular sentence, when you write, individually when you are writing one sentence, you need to introduce a person. But when the thread is continued, every time you should catch the thread. Thread is going on. From the beginning to the end, thread is going. Then why in every sentence you should use Mr. McCarthy? Many logical points I'll be teaching. Many people don't want to attend these sessions. I know, forget about them. If you want to get 400 plus, come to lecture. I don't give 100 lectures. I don't finish off in 30 minutes flat. Oh, we are very busy, sir. We are doctors, we are nurses, we are very busy. We don't have time. We have to look after our job. We have to take care of our children. We have to do cooking. That is your problem. That is your problem. There's a non-stop nonsense. Always it will be there. I also have many things. I also have many things. That's not our problem. Our goal is something different. Quality is important. Okay. There's a poem in our language. There's a poem in our language. I want to tell you that poem. It's in our language, but I'll translate it to you. It says like this: Gangi govu palu, garitadainanu chalu. That means Gangi govu palu means the milk of a cow, a small ladle full of milk is enough. Kadivedaina nemi haramu palu. A cauldron of milk, if it is a donkey's, what is the use? A famous person wrote this poem long back. He's called the naked priest, Vemana. He doesn't wear clothes. He lives in the jungles and forests. Salutes to him. Even these days, people remember his poems. So, you write too much, but when it is baseless, useless, and meaningless, what's the fun of it? Why people are not able to get 350 marks? Sir, you are telling why you are writing, why you are not writing. I'll show you the proof. You go to official OET. I'll show you just a second. People don't like to attend quality. That's the problem with people. That's not our problem. You are here. You are my children. You are here ready to learn many things. So I'm going to show you those things. So OET official. Okay. OET official site. Okay, active or passive. Just type like that. So, official OET practice. OET writing, active or passive forms. What is the importance? OET is telling this, not I. Okay. I think we bumped into the official OET. Yeah, here it is. Official OET site, writing, subtest. Yeah, not this. Here it is. They are changing the format. So old site is changing to new site. Earlier it was occupationalenglish.org. Now it is oet.com. Yes, they are making some more. So here, writing, this is official. So here, what is passive structure in writing? Yeah. So he has given here, official oetwriting.com. Let us go there and just check there. So writing, active or passive. Let us just check there. The patient or the action. Okay, last time also I have shown many times, but active or passive form is better in the OET writing subtest. It's okay, I don't want to waste your time there. Okay, so when you're writing something, so what is more important? The person who is doing the thing or the action done is important? So here the patient is the priority and the patient's problem is the priority, and each sentence, the particular, yeah, 1 second. So in each sentence, what is freshly introduced, this should become the topic. Note it down, note the point down. So in every sentence, whenever you are writing a new sentence, what is freshly introduced, that should become the subject of the sentence. So Take that one. In this one, monitoring is important. So start with monitoring. So I have been monitoring Mr. McCarthy for any signs of infection. So I is important, or McCarthy is important, or monitoring is important. I is already there from the beginning. You are not introducing I here. The person who is doing is not introduced here. Introduced in the beginning itself. Okay. Then next, I am writing stuff. From there only you introduce yourself. Who is this I? The doctor or the nurse. Now, Mr. McCarthy is even introduced even before subject line. Subject line. The patient. Okay, introduced. And the person who is receiving the letter, the reader of the letter, he is also introduced in the first line itself, dear Dr. McCarthy. So, these three persons are not important here. These three persons are not important. Because they're already introduced in the beginning and the thread goes till the end. So don't take these names too many times. That's it. Don't take the names too many. Every sentence has its own subject. Give importance to that one. Okay. Don't dethrone that one and bring I, Mr. McCarthy, or you and put them in that place. Give the importance to that particular sentence. For example, if you are writing about medications, start with medications. Aspirin dosage has been increased. Finished. Aspirin dosage is important. Okay. Please give double the dosage of aspirin. No need. Why? Why you please give? Why you should come there? I recommend to double the dosage. Why I? Mr. McCarthy has to take double dosage. Why Mr. McCarthy? Why I? Why you? Why Mr. McCarthy? Many people lose the quality by bringing I or you or Mr. McCarthy. That's the problem here. Forget about others. You are Grandmaster class students now. Are you a regular student or not? I don't mind. But you are attending. So you deserve quality. So bringing in I or you or Mr. McCarthy into the picture of that particular sentence is not recommended. You are making buttermilk out of curd. The more you put water, the lighter it becomes, and the taste will be fading away gradually. The more nonsense you put, the more quality will be deteriorated. That's it. Okay. Don't try to fill the nonsense stuff. Every paragraph we have to write Mr. McCarthy in the beginning. Next, full name we have to write in the beginning. First paragraph. Why first paragraph? Already subject line is there. Na? Then what should we write? This is the way how you have to write. Then every other sentence we have to write he. Why? Unnecessarily every sentence you are adding a word which is related to McCarthy. Why? Avoid as far as possible. Because it is understood. If it is not understood, that means the other person who is the reader, it doesn't make common sense. So, not compulsory, not necessary. Every sentence has its own subject. Use that subject. That's what I want to tell you. So, now 3 points. Number 1, or you can say A. A is the writer. Okay. Number A is the writer. There are 3 people which will unnecessarily drop into every sentence. Be very careful. Be very careful and controlled. The writer who is writing, say, I am writing, I recommended, I gave this medicine, I treated. In your speaking also, oh, too much nonsense. Too much nonsense. I am telling you, I am assuring you, I am reassuring you. I am reassuring. Instead of reassuring, you are using the word reassure. I am, you are great or what? I will give you medicine. I will help you. Are you great? Are you the master of the universe? If you are not there, nobody else will do it. You are the only one person in the world who is going to do it. You are not the only one. You are not the only one. So you are not important here. If you are sick, if you are busy with some other work, then what happens? Somebody else will replace you, right? That means any nurse can do this job. Then why are you giving this importance saying I, self-importance? This letter is a formal letter where self-importance or self-boasting or self-explanatory sentence should be avoided. In formal letters, no, not self-centered. It is subject-centered. Remember that. Subject-centered. Why people do not get marks in the OET writing? Why they are failing so many times? Because they are self-centered. They say, I am ready. I gave a medication. I recommend. I suggest. I advise. In your speaking or in your writing, you're doing. If you avoid these things, you'll get 450 marks. That's what many students got. That's how you will get. So avoid, you are not important. You are not important at all. If you are missing, somebody else will take it. Today you are there, you are doing. Tomorrow, then if you are absent today, who will write this discharge letter? Somebody else will write, na? Nobody will be there to write this letter. How is that possible? So do not give self-importance to formal letter. In formal letter, there should not be personal letters, personal pronouns. Personal, formal, personal means a friendly talk you can use personal. I am this, I am that, I am that. But when you go to formal discussions, if you go to your boss and say, I did this, useless fellow, you are given salary for doing only, now what you did. If you don't want to do this, get lost. Somebody else will come and do. What's the problem? Why are you telling that I did it? What is the greatness? You are getting salary for that. No? If you are not there, somebody else will do it. What's the great deal you have done? Why are you thumping your chest? I did it, as if nobody else in the world will do it. That's called self-praise. That is a negative point in the formal letters. You can write, but you should avoid. Okay, you can write. That quality is low. I'm not telling you don't write. You write. Do whatever you want. You give empty paper also. Who is bothered? Instead of giving empty paper, you are writing something. When you are helpless, when you are weak, when you don't know what is the quality, you write. You're writing because you don't know. When you start learning it, you'll stop doing it. Okay? You'll stop doing it. That's it. Number 2, B, the reader. Now, second one is the reader. Okay. Now, here the reader is reading your letter. Many people say, I am writing this letter to you. You mad fellow, why are you writing? I am writing this letter to you. To refer. I am writing this letter to you. To refer, Mr. McCarthy. Why you are writing? I am writing this letter to you. You are writing the address, no? By seeing the address only, he will know that you are writing the letter. Dear Dr. McCam. To you only, no? McCam only will open and read, right? Then why are you saying you? You are writing to McCam. McCam is only you. Then why again you? Why are you bringing? Yeah. I request your expertise. Your please, you please do the needful. Please do the needful. I'm telling you, here no you is there. But do you think you is not there? Please do the needful. To whom you are saying, please do the needful? You will tell to the person who is in front of you. Okay? That means the person in front of you, the person who is reading, you're imagining him in front of you and telling. So that means you only, it's understood. Come here. Whom will you say come here? You come here. The person you're pointing or you're looking at them and you're saying come here. That means who? Somebody is out of the room. Somebody is playing in the football ground. You're telling you come here. No, no. You're telling someone, you are giving an order or a command or a request. Please give me some information. To whom you will tell? To the person in front of you. That means you is hidden there. You please come here. You please sit down. So you is understood because you are looking at them and you are talking to them. You is understood and you are avoiding them. Provide suggestions. Means who should provide suggestions? You should provide suggestions. The person who is reading. So that means you is there. Even if you are not writing, you is there. You should monitor him regularly. Why you should monitor? Some people say, you remove you. You should monitor him regularly. Remove you and remove should and say, monitor him regularly. Who should monitor? You only, na? You is there, hidden there. You think it is missing? It's there. Why are you giving importance to you there? You're telling monitor him regularly. Who should monitor? The person who is reading only, na? So you monitor him regularly. It is written, not written, but it is understood. Why are you using that you, hiding and using that you then? Remove you. Remove you. You're saying, sir, I'm writing starting with monitoring only, no? Monitor him regularly. You're giving an order to the person in front of you. That means you're not writing monitor, you're not giving importance. Hidden receiver is there. It's hidden, but it's there. Why are you giving importance? Hiding, but you're still giving importance. No? Monitor him. That means it's an order. Come here. Who should come here? You should come here. You is there. How can you say it's not there? I'm not talking about you. I'm not talking about him. I'm talking about personal pronouns. Though it is hidden or not hidden, they should not be there. Then how can we write, sir? Take the object, the receiver of the action. Okay? Right? Regular monitoring is recommended. I am recommending you to monitor him regularly. So regular monitoring is recommended. The words will come short. This is called brevity. Brevity. Brevity means precise. What is information needed, that much only you will write. You will not stuff. What you people are doing, many people, what you are doing is, you are stuffing in nonsense and overloading with unnecessary information. And you are thinking about word count, right? And the quality is deteriorating. How many he's will be there in the letter? How many McCarthy's will be there in the letter? Okay, one time you wrote in one paragraph, okay. Too much. In every sentence there is a he or Mr. McCarthy. He or Mr. McCarthy. Every time it is there. First sentence McCarthy, second sentence he. Why? Don't overstuff with personal pronouns, because this is a formal letter. This is a formal letter. Formal letter means official letter. Don't bring yourself in that one. Write as if anybody who is writing will write in the same way, like that. Remove I. This is called emancipation, means separating yourself from the main point. Separating yourself. For example, a coach is training the players, and the players will play. The coach is coming out, and the players only can play, and the coach is silently watching. He cannot go and play direct. Like that, you let the players play. That means let the subject play, and you don't involve in the football match. That is what I am telling you. Don't involve. The other person who is receiving and the reader, he is a referee or umpire. He is watching you. Don't come and make him also play. You are a coach and there is a referee. Now what you are doing, this coach is also playing, referee is also playing. What will the players play then? You are diluting the quality and making a formal letter informal by using all the personal pronouns a number of times or multiple times. Why the students are getting 450, above 400? Why? Because of quality. That's it. Last time I was shocked, one student, he got 290 marks. I don't want to name the person. He was a regular student. He got 290 marks in writing. He said, sir, if I get 10 marks, I can club my score. I can get, writing is 300 is okay. Nurse, 300. 10 marks, sir. I said, no, you don't deserve 10 marks. You deserve more than 400 actually, I told him. I said, you deserve more than 400 because your quality is there like that. Then he applied for revaluation and he got 350. 60 marks he got. Because of the quality, I had a confidence. I said, go. And he got it. I was very surprised. He did not get 3 Bs and 1 C plus. He got 4 Bs. And one of it is one of the certificate which I have put there in the Telegram channel. Look into that. I have the proof. I have the evidence. Okay. So that's very important. The confidence. Confidence. Right? He was just begging for 10 marks. I was saying, no, you deserve better. Then he was surprised. I was not surprised because I know as a mother what type of quality I gave to my child. I fed royal milk. Okay. He should be paid royally. That's it. That's what was quality. Right. And the third one is the case. The patient. See, the patient don't attend 100 classes. They attend 10 classes. Wonderful classes. The patient. And such lectures happen. Even if you want to take leave, you can take it. Or if you want to sleep, you kill your sleep. No problem. I'm there now. I'm also killing my sleep. I have worked from morning 8 o'clock, but still I'm there with you. The patient. The patient. I told you 12 points I have given you. What are the 12 points I'm dealing with entirely? The patient. Now, what is this patient? This patient is also throughout, from the beginning to the ending. He's more important than the person who is writing the letter, the writer, and the person who is reading the letter, the reader. The sender and the receiver of the letters. The patient is more important. Because of the patient, only this sender, this receiver, this writer and this reader, both are there because of the. If there is no patient, where is the reader? Where is the necessity of the reader? Where is the necessity of the writer? If there is no case, if there is no patient, the writer will not write the letter and the reader will not read the letter. That's it. So the patient is important. Because of the existence of the patient, the very letter is getting shaped. Now, is this patient important? Yeah, this patient is already important, and the importance is in vogue from the beginning. Vogue, V-O-G-U-E. In vogue from the beginning of the letter to the ending of the letter. You are just harping. Yes. The harmonium, You're just beating it from the beginning to the ending. He's always there. The importance is always there. You need not give double importance to him. He is already important. That's why the very letter itself shows that he is important. Okay? It's important. So why do you want to dilute the great importance and bring it cut down to shorten and make him exist in each and every sense? It's already understood. The medications are for this subject, the treatment is for this subject, the monitoring is for Mr. McCarthy, the observation is for Mr. McCarthy, the suggestions are for McCarthy, the doctor is for McCarthy, the receiver, the reader is for everything. And why you are every sentence, why are you bringing him down and making the king a soldier? Why are you making the prime minister as a chief minister of every state or as a president of the president of America cannot be the mayor of every city or the governor of every state? Why are you degrading the level of the president? The patient is the president, and you're degrading him to every sentence and bringing him and spoiling his reputation and name. He cannot do justice in each and every sentence. Every city has a mayor. Every state has a governor. Don't degrade the president's role to the level of a governor and a mayor. Sorry, you're doing injustice. You're doing injustice. That is what is formal letter. Okay. Now, in one sentence, now I'm going to ask you, come on, active. Even if students, three sentences of students are, I need only those people who bring quality to me. Yesterday, there was one Iranian doctor. She said, just by attending your lectures, I got this course. I'm proud of her. Those people who are paying me thousands, they are not ready to attend the lecture. But there are people who watch my videos and they're passing and they're getting, there are many students, they don't tell me, but there are some students who tell me, thank you very much, sir. She did not give even one penny to me, but the message he sent me, she said, sir, I passed because of you. That is worth more than 100 people paying me money. That is the pride of a teacher. Okay. You are paying for my services, sitting here and teaching you so much. Okay. But that result, which she, not even a penny she paid me, that is very precious for me. And if that person who has studied without my physical presence, just by watching my videos, she has got 390, 380, then you deserve more, 450. Okay. So try to get that. Now we are going to the subject. We are going to the point here. Yes. Now here is our question. Now in each sentence, okay. Now let us see in each sentence what is important. Okay. Now in this sentence, what is important? In this sense, surgery important or performed important or complication important? Which is important? Surgery is important. Okay. Surgery is important. So let us take here, requires assistance for ADLs plus wheelchair for mobility. So assistance is required for performing activities of daily living. Okay. Assistance. So yeah. Medicines. Yeah. Okay. So assistance is required for performing activities of daily living. Full stop. This is one sentence. Requires became is required. Assistance is required for performing activities of daily. For whom? For Mr. McCarthy. So who is recommending? You are recommending. So he also should follow that one. Maybe like that. Assistance is required for performing activities of daily living. Now, or during the entire period has been required or has been provided. So, medical progress. Okay. Assistance is required for future. Now, in the past. Past, present, assistance is required. Or you can also say another sentence. Assistance has been provided. Okay. For performing activities of daily living will be the same. It will be there. There's no change in that. There is no change in that. Right. Next sentence, number 2. Wheelchair for mobility. Wheelchair for mobility. Okay. Mobility has been possible with the support of a wheelchair. Mobility has been possible with the support of a wheelchair. Or mobilization has been possible. Mobilization has been possible with the support of a wheelchair. Or ambulation has been possible with the support of a wheelchair. So try to understand here very clearly how we are going to write these sentences. Mobilization or mobility or ambulation. You can write like that. Okay. So you can write, he has been mobilizing with the support of a wheelchair. But why he? It's understood, no? How many patients are there? Is there any confusion? Is there any confusion? Mobilization has been possible. Mr. McCarthy has been able to mobilize with the support of a wheelchair. Why Mr. McCarthy? Why he? Yeah, tell me. Tell me, please. Am I talking sense? Am I talking sense? Or are we developing quality here? No need to do 100 sentences. Just learn some sentences. That is enough. Okay, next. So this we have done already. Check for fever, chills. Check for fever, chills, or any other signs of such infection. Okay. Check means monitor. Check means again monitoring. Yeah. So check for fever, chills, plus other signs of infection. Already we have seen earlier. Okay. So this is past tense. This is medical progress. Okay. Is it required for him? So person who is receiving this letter, the person who is receiving this letter, yeah, who is receiving this letter? Okay. Nursing management. Okay. So skilled care facility, Shannon McCann, Knox skilled nursing. You're sending to nursing skilled, okay, nursing facility. So do they need this information? What medical progress? If it is needed, you add. If you don't need, leave it. Like that. You have to be selective. Next. Encourage oral fluids and nutrition. What you have done. What you have done. So, check for fever and chills. Who checked? You checked it. Medical progress, na? During hospitalization, nursing management, you have done. Okay. So, right. Regular checking, regular periodic checking has been done for any signs of infection or episodes of fever and chills, like that. Encourage fluids, and so this is also what you have done, not future. Okay. This is what you have done. So how are you going to write this sentence? Oral fluids. Start with oral fluids. Oral fluids and nutritious food, nutritious food were have been encouraged for a long time, no? Have been encouraged, not past, recent, present. Okay, recent, past, present, from hospitalization till now. Oral fluids and nutrition food have been encouraged. Or you can write, besides, not beside, besides, or in addition to oral fluids, comma, nutritious nutritious food has been encouraged. Nutritious food has been encouraged. Oral fluids as well as nutritious food have been encouraged. Not only oral fluids, but also nutritious food have been encouraged. Both oral fluids and nutritious food have been encouraged. I hope you understand the different styles of writing. I hope you understand the different styles of writing. The same thing, different styles. Okay. different styles. Don't write some words which are not recommended. Check. Yesterday I have given you check for those words. I told you. Now this one. Assistance has been assistance has been provided to perform activities of daily living and mobilization for shorter distances. Okay. So you can see that one there. Assist with ADLs and mobility. Assistance has been provided. This is during hospitalization. Okay. Assistance has been provided to perform activities of daily living and mobilization for shorter distances. Right? So you can also say, instead of to perform, you can also say for performing. The to infinitive or for plus gerund. Both are correct. And now remove this and you can say as well as. So instead of and, too many times we are writing and. So as well as. Assistance has been provided to perform activity of daily living as well as mobilization for short distances. You can use not only but also. You can use both and. You can use in addition to. You can use additionally. So how you are going to write, that is in your hands. Okay. Change dressings daily. Regular daily dressing changes have been provided. The dressing on the incision site has been changed regularly. Or you can say the dressings on the incision site the dressings on the incision site have been changed regularly. Okay. If it already written, don't write. Same words, don't write again and again. So ensure good urination and bowel movements. Yeah. Urination. Okay. So urination. So regular urination or normal urination or standard urination or whatever you know better. Okay, regularly, urinate regularly. Okay, and bowel movements have been ensured. This is finished, na? Have been ensured. Finished past. If it is, I'm just making you how to make sentence. I'm not telling you these. Everything will go into the later. Just learn how to make sentences. We're learning sentences. That's all. Normal urination and bowel movements have been ensured or are ensured. Okay. Frequent turning is recommended in order to avoid decubitus ulcers. Frequently changing the positions is suggested for avoiding decubitus ulcers. Avoiding decubitus ulcers is extremely important, and therefore frequently changing the positions is suggested. In order to avoid decubitus ulcers, changing the positions frequently is advised. So in this way, different types of sentences you can write. Okay. So this is how. Assessment. Now discharge plan. Discharge to skilled nursing facility for acute care and physiotherapy. So for, this is the purpose of the letter. Okay. acute care and physiotherapy are recommended. Mr. McCarthy requires Mr. McCarthy requires acute care and physiotherapy. Providing acute care and physiotherapy would be profoundly beneficial for enhancing the present condition of Mr. McCarthy. You may say, sir, why you are telling? Why are you writing? You said, don't write Mr. McCarthy, don't say, but why you are telling? I'm just telling that you can put in brackets, okay? That's enough. Understood? Okay. You can eliminate that one. Antibiotics and pain medication should be continued. Continuation of antibiotics and pain medication is recommended. Not only antibiotics, but also pain medication are recommended. Antibiotics and pain medication should be continued. So, how you are writing is important. If you want to write with them, you can write like this also, but quality is going. I suggest you to I suggest you to make Mr. McCarthy all the nonsense we are putting now, all the nonsense, to continue pain medications and okay, antibiotics and pain medication. I suggest you to make Mr. McCarthy or ensure Mr. McCarthy to continue antibiotics and pain medication. So I is unnecessary, U is unnecessary, McCarthy is unnecessary. Instead of this one, just better to say, please continue. From here to here is not needed. So just say, please continue. Finish now. Right. We'll need to follow with vascular surgeon in 2 weeks' time. So simple. If you understand the style of writing, it's so simple. Okay. An appointment has been scheduled after 2 weeks. With the vascular surgeon. The vascular surgeon. An appointment with the vascular surgeon for what? Follow-up. An appointment, a follow-up appointment. An appointment for follow-up with the vascular surgeon has been scheduled after 2 weeks. Okay. So this one will go last. An appointment for follow-up with the vascular surgeon after 2 weeks has been scheduled now. Already scheduled. Appointment is after 2 weeks, but scheduled now only. Na? When it is scheduled, he is not telling, but appointment when? 2 weeks. That should come before scheduling. Okay. So this is how you are going to write the sentences. So we have covered most of them. Right. So that's good. We are here now. So most of you understood the importance of quality. Unless and until quality is there, you will not get 400 plus. Don't settle down for less 350. You deserve 400 plus. Okay. Now, my message is very clear. You have to improve quality. That's what I have shown you. How to find out how to write the letter, how to step by step, how to make sentences, how to choose the information. Okay. And what are the different types of letters, and what is the passive voice, what is the active voice. Lot of things we have learned. So did you learn anything new? At least one point. If you have learned, just mention what you have learned. Yes, Dr. Keval Shah. Unmute. No need to open your video.
Yes, sir.
Okay.
Am I audible, sir?
Yes.
Yes, sir. Definitely, I learned about quality and the construction of sentences, because yesterday I was facing a lot of difficulty, but now I understood everything about types of letter, what to write in that letter, and how to construct or form sentences, because I'm lacking in that aspect. So definitely it helped me.
So we spent almost 2.5 hours or more than that, 3 hours. So
Yes.
was that beneficial or was it a waste of time?
No, sir. For me, if you ask me, it was definitely beneficial. And yeah, my all doubts are clear now. So I just want to practice that area of making sentences.
Right. Thank you very much for your message. Next, Busayo Adebola, Josephine Adebola, Busayo Adebola. Yeah. Unmute, please. You can share your experience if you can, if you are comfortable. I don't know what time it is there for you. Yes. Bubu, Busayo. Okay. Dr. Neha was present from the beginning. Yeah. Dr. Neha, do you want to share anything? Did you learn anything new?
Yes, yes, sir. It was very helpful, and I focused too much on the body of the letter before attending your lecture, and now I know I have to give equal importance to the beginner and the ending portion as well. So thank you for that. Of course, the that using passive voice is more advantageous. That also is clear to me now. Thank you.
Yeah, welcome. Omote.
Thank you so much, sir. It was
Yeah, can you
beneficial to
introduce
me.
yourself? What is your name?
Toyin, Omotoye.
Yeah, same correct name. Okay, fine. Yeah, share your experience. What did you learn and how was it beneficial for you?
Okay, firstly, I want to appreciate you, sir, for giving us your time to put us through. This lecture was beneficial to me. Today, I was able to add more knowledge about the address, because previously, when it comes to nursing's address, I don't usually put the title under nurses. So I was able to pick that today. Then the reference or the closing remark and the sender particulars. So previously, I usually put maybe charge nurse or a senior nurse. So I don't used to include other parameters, but I was able to get that today. Then going with the body, with the sentence constructions, it was so helpful for me as well, because I was able to differentiate between the active and passive sentence using of past tense and the present continuous tense. Thank you, sir.
Yeah, welcome. Sure, that's very nice. Adebola, if you want to speak anything, you can speak. Otherwise, that's the end of the session. So write this letter and submit me tomorrow so that I can correct these letters. Have a great day.